Good day, here I am again. I'm Josephine Ginto from BSED student, and I'm going to discuss now about the 3 common skin infection with their causes, symptoms, treatment, and prevention. So first, let's begin by looking the diagram, the skin structure. So as you see in the diagram, there are different layers of our skin. So our skin is our first line of defense against infection. And the many layers of skin provide different types of protection. So the first layer, known as the epidermis, it is your immune system shield protecting your body from the onslaught of infectious bacteria, viruses, yeast, parasites, and fungi that are nearby. And the second layer of the skin is the dermis, which supports your skin's surface, supplying it with nutrients and making it tougher. And the third and final layer of the skin is the subcutaneous zone. So this is a layer of fat that acts like a shock absorber, keeps your temperature steady, and stores energy. So all of your skin layers work together to ward off skin infections. But how does your skin get infected? So for example, a cut in your skin, maybe from an injury or surgery, so makes it easier for germs to get in, and that can lead to infection. So viruses, bacteria, and fungi can all cause them. Because bacteria are living organisms that all around you, and many are harmless or even good for you, but some can cause problems. And the viruses are tiny particles that can only grow inside other living organisms, and the fungi are living organisms that feed off other living things or organisms. So the skin infection occurs when parasites, fungi, or germs such as bacteria penetrate the skin and spread. And when this happens, it can cause pain, swelling, other types of discomfort, and skin color changes. The skin infection may be mild or serious, and there are 4 types of skin infection. First, the bacterial skin infection, viral skin infection, fungal skin infection, and parasitic skin infection. So the bacterial skin infections often begin as small red bumps that slowly increase in size. So some bacterial infections are mild and easily treated with topical antibiotics, but other infections require an oral antibiotic. The second is the viral skin infections that are caused by a virus, and this infection range from mild to severe. And the fungal skin infections, this type of skin infections are caused by a fungus and are most likely to develop in damp areas of the body, such as the feet or armpit. So some fungal infections are not contagious, and these infections are typically non-life threatening. The last is the parasitic skin infection. So this type of skin infections are caused by a parasite, and these infections can spread beyond the skin to the bloodstream and organs. The parasitic infections is not life-threatening but can be uncomfortable. So I have here 3 common skin infection. First, the cellulitis. Cellulitis is a bacterial infection in the deeper layers of skin and the fat and soft tissue underneath. So, some bacteria are naturally present on the skin and do not usually cause harm. However, if they enter the skin, an infection can result. So, bacteria can enter through cuts, grazes, or bites. And this kind of skin infection that is a serious bacterial skin infection that happen most often on your lower leg, but it can be anywhere on your skin. So the area may get swollen, hot, and tender. So it can be very serious if it is in deeper tissues and gets in your bloodstream. So And these are the symptoms of the cellulitis: redness and swelling, warmth, tenderness and pain, chills and cold sweats, shivering, a fever, and nausea. So if you have red streak on your skin or fever, chills, and aches, see your doctor right away. So the causes of this skin infection is by the bacteria from the Streptococcus and Staphylococcus groups are common on the surface of the skin, where they are not harmful, but if they enter the skin, usually through a cut or scratch, they can cause an infection. So the treatment of this skin infection: first, early treatment is key to a successful outcome without complication. So why? Because if a person does not receive treatment, cellulitis can lead to blood infections and damage the immune system. And the most typical treatment is oral antibiotics. And also a person should also rest, elevate the affected area, and cover it to aid healing. So the prevention of this skin infection: a person cannot always prevent cellulitis from developing, but there are some ways to reduce the risk. So first, treat cuts and grazes. So keep any cut, bite, graze, or wound, including those from recent surgery, and clean to reduce the risk of infection. Second is avoid scratching. So if an insect bite, for example, is itchy, uh, ask a pharmacist about how to reduce this feeling. So when scratching is unavoidable, keeping the fingernails clean and short can help prevent infection. Next is take care of the skin. So moisturizer can prevent dry skin from cracking, but they will not help if an infection is already present. Next is the protect the skin. So example, wear gloves and long sleeve while gardening, and avoid wearing shorts if there is a likelihood of grazing the skin. So covering up can also help prevent insect bites. Next is maintain a healthy weight. So obesity may raise the risk of developing cellulitis. So maintain a healthy body weight. Next is avoid smoking and limit alcohol use, because this can also increase the risk for having cellulitis. And last, seek help for other medical conditions. People with diabetes, for example, should do their best to manage their condition. So the second skin infection here is the warts. Warts are non-cancerous skin growths that occur when a virus infects the top layer of the skin, and it can occur anywhere on the body. It can look like a solid blister or a small cauliflowers. Warts are caused by a virus in the human papilloma virus or HPV family. So the appearance of a wart depends on its location on the body and the thickness of the skin. So the symptoms of warts are usually visible as raised areas of skin. They are much more likely to form in places where skin damage occurs, so especially on the fingers, nails, and backs of the hands. So the treatment of the warts: the dermatologist can usually remove common warts, but typically techniques include the cataridine, a substance that causes a blister to form under the wart, so the dermatologist can clip it off. Second is electrosurgery or burning of the wart. Third, excision or cutting the wart off. And last is cryotherapy or freezing the wart off. And the more difficult cases can require an additional therapy such as laser removal. So the prevention of the warts: first, do not touch other people's warts. Do not use other people's towels, wash clothes, or other personal items. Do not share shoes and socks with other people. And next, do not scratch wart as they can cause them to spread. And wear sandals when entering and exiting communal showers and pools. Next is cover warts with a waterproof covering when swimming, and socks or gloves elsewhere, for example at the gym. And next, do not brush, comb, shave, or clip hair in areas that have warts. And when peeling or cutting nails, do not use the same utensil on the infected nail and the healthy nails. And do not bite fingernails if warts are near them. So, the last is keep hands as dry as possible. And the third common skin infection here is the herpes. The herpes result from infection with the herpes simplex virus or HSV. So, it causes sores or blister to form in or around the mouth or genitals as well as other symptoms. So, there are two types of herpes simplex virus. The first is herpes simplex virus 1 causes oral herpes which usually affects the mouth and surrounding skin. Second is the herpes simplex virus 2 causes genital herpes which is usually sexually transmitted. So if a person has an herpes simplex virus infection, they will have it for the rest of their life. Though some people never develop symptoms, but if symptoms occur, they reflect the type of herpes simplex virus. And there is no cure for herpes, but treatment can help manage symptoms and reduce the likelihood of them recurring. So, the symptoms of herpes glandular flares, it can cause swollen glands, fever, a tingling sensation in the affected area, lesions or blisters that last between 7 and 10 days, and clear fluid-filled blister that may be painful and surrounded by a discolored patch. So, the causes of this skin infection, so when herpes simplex virus is present on the skin, it can easily pass from person to person through contact with the moist skin of the mouth and genitals, including the anus. So, first causes is having vaginal or anal sex without using barrier protection such as condom, sharing sex toys, and having any other oral or genital contact with a person who has herpes. So, there are several treatment options for both oral and genital herpes. First, taking pain relief medications such as acetaminophen or ibuprofen, bathing in lightly water or soaking in a warm sitz bath, applying petroleum jelly to the affected areas, wearing loose clothing to avoid irritation, refraining from sexual activity even with protection until symptoms have gone, and applying a cream or lotion to the urethra before urinating, such as one that contains lidocaine. So, there are also the medication of this kind of skin infection. So, no drug can get rid of the herpes virus. However, a doctor may prescribe an antiviral medication such as acyclovir to prevent the virus from multiplying. And meanwhile, over-the-counter herpes treatments, which are often creams, can help manage tingling, itching, and pain. So, these are the following strategies can reduce the risk of developing or passing on herpes. So, first, using barrier protection such as condoms when having sex, avoiding sex while symptoms are present, avoiding kissing and oral sex when there is a cold sore around the mouth, And last, washing the hands thoroughly, especially after touching the affected area during an outbreak. So that's all, and thank you for watching and listening.